Hi everybody, I thought I would come on here because I am a clinical audiologist. My name is Dr. Jaslina Huja-Michaels, and I know a lot about tinnitus. And technically people are like, is it tinnitus or is it tinnitus? The medical correct term is tinnitus, but either way, it's fine. I'm just here to give you information about it. So typically, tinnitus is an annoying, buzzing, chirping, hissing, ringing in your ears. The brain is creating a sound. The reason why the brain creates the sound is because oftentimes if there is hearing loss, the brain tries to compensate where the loss is by putting its own sound in. Kind of like phantom limb, right? If you don't have the limb, but your brain still perceives the pain and the feeling of the limb. Okay, so in audiology, we see a lot of tinnitus patients. That is in our scope of practice. So if you're somebody who went to a doctor or an ENT and they were like, oh, you got that ringing in the ears, nothing you can do about it, I'm really sorry, because that was not the right answer that you should have gotten. What they should have said is, oh, okay, you have ringing in the ears, go see an audiologist. Because typically ringing could be caused by damage to the auditory nerve. Most of the time, tinnitus is related to hearing loss. Like I said, the brain is trying to compensate for a sound it's not receiving. There are cases where it's not hearing loss related. They could be vascular related. And you know that a little bit more if the ringing is like a pulsatile, it's like a heartbeat. Anyways, it doesn't matter how old you are because hearing loss doesn't age discriminate. If you have ringing in the ears, I would highly advise you to go get a hearing test just to check the boxes. But there are things that can trigger tinnitus. High sodium can definitely make it worse. Lack of vitamins, lack of sleep, anxiety, stress, depression. Of course, when I tell my patients that, they're like, check, check, check. Okay, I get it. Like literally every one of us is stress, but the root cause of it is typically damage to the auditory nerve. So if you're seeing this, I just really, really hope that I can shed some awareness because it is literally in my scope of practice. I'm not just someone here on TikTok talking about something that I know nothing about. It's in my scope. I want to help anyone who is suffering from this. And even if you're like, I'm 23, I'm 25, there's no way I have hearing loss. Here's the thing. A lot of times audiologists, their equipment only tests to 8,000 hertz, and you're not really gonna find a lot of loss. But try to go to an audiologist who tests beyond 8,000 hertz. So our equipment at Hearing and Brain Centers, we actually test to 16,000 hertz. And more than often I see, bam, there's hearing loss beyond the 8,000 hertz frequency, which could be the reason why that you're experiencing the tinnitus. I literally had a man, this is so long, I'm so sorry, but I had a man who tried red light therapy, acupressure, like pills, and he probably spent more than $30,000 trying to find treatment. He finally came to me. Lo and behold, he had really, really bad hearing loss. He had like stage 3 hearing loss. We do our losses in stages. And he, of course, got prescriptive hearing devices with us, properly treating his hearing loss. And it is literally the first time in 15 years that he has not heard the ringing. At the end of the day, all I want to do is just educate people. It's completely up to you whether you decide to go see an audiologist, go get your hearing checked. But there have been too many cases where people have literally taken their life because the ringing got so bad and no one told them to go see an audiologist. And that really breaks my heart. I myself have had suicidal tinnitus patients and we got them in treatment and they have been doing so well. Okay, this is going to make me cry. They've been doing so well, so I know that if you're suffering from it, please just realize there are things that you can do and you're not alone and we can figure this out together. If you want to message me, I will try to give you any of the resources that I give my own patients, but please know that there is hope. And even though there's no cure, we can absolutely successfully manage it. Just don't give up on yourself.